Welcome to Bunny Hugs and Mental Health, the podcast that deals with all things mental health. We talk to professionals, survivors, and loved ones about their sometimes informative, sometimes uplifting, and sometimes tragic stories. I'm your host of the show, Todd Rennebaum, advocate, recovering addict, experienced sufferer of depression and anxiety, and author of the children's book, Sometimes Daddy Cries. Hello and welcome to another episode of Bunny Hugs and Mental Health here on the Saskatchewan Podcast Network. I am your host, Todd Rennebaum. Now I'm a little excited today. I got a brand new microphone, so if I sound a little different, that's why. I don't know if I like it yet or not, but it's different, and I'm excited because I'm trying it. This is my first time recording with it, so we'll see how this goes. Thank you, everybody, for listening. The podcast is still number 19 on the top 100 podcasts. Well, top 100 mental health podcasts on the internet, according to the website FeedSpot. Now, I don't know what that means exactly or how they figured that out, but it's still pretty cool. So thank you for that, and thank you for listening. You know what? And tell some friends about it because I want more people to listen. So yeah, it's just that simple. Please tell some friends about it if you like it. Now, in the next few weeks, I got some really cool guests coming up. Including this week, but I have a fellow named Chris, and he is with a group called Accidental Impacts. They are people that accidentally have killed someone, whether it's in a car crash or some other accident, and their support group, and he's going to talk about all the mental health issues, the shame and guilt, and the things they have to go through being someone who accidentally killed another person. After that, I have another person called Alyssa. She's from Miami, and she's a therapist, and she's come up with her own therapy techniques. It's called RIP-R therapy, and it's all about OCD, about treating OCD. She herself has OCD and has been treated, so she's pretty fascinating. But today, I'm speaking with Dr. Tracy Dalgleish from Ottawa, Ontario, Canada. She is a relationship expert, an author, a speaker, a podcaster, and a mother of 2 children. Now, I asked her to be on the show to talk about more men's role in mental health. Why is it that men have a harder time opening up, feeling emotions, talking about emotions and stuff? But we do kind of go back and forth about both genders and relationships and stuff. She is super knowledgeable, incredibly insightful, and she accepted some of my smart-ass comments, so that's always nice. She chuckled. I don't know if she was sincerely finding them funny, but still, it was nice of her to do this. Honestly, this is a really good episode. She is amazing. You can listen to her podcast, I Am Not Your Shrink, pretty much anywhere that you can listen to podcasts. So, without further ado, I give you Dr. Tracy Dalgleish.
So you joined my chat with Curious Neuron and with Emmanuel.
That's right, yeah. And you guys were talking about, I think it was like men's health and mental health in men and masculinity and all this stuff. And that's a topic I've been wanting to do for a long time on my podcast. So that's why I reached out to you. So I'm hoping we can discuss that today.
I hope I can do it justice today. I feel like we need to get Emmanuel here to sit with us because, I have to say he and Dr. Cindy really brought that conversation alive. And yeah.
Yeah. Well, actually, I'm going to be doing an Instagram live with Emmanuel in a couple of weeks. So
great.
Yeah, we've kind of bonded a little bit now. So
that's great.
So with that, why do you think men do have a hard time opening up about their mental health and seeking help?
Yeah. Oh, it's such a big question.
I know.
Would it be okay? I know this is your podcast. Would it be okay if I asked you first? You're the expert sitting in your position.
Yeah, sure. Yeah. I know we can go off track. We can talk about whatever you want, but yeah.
Not to put you in the hot seat, Todd, but yeah, why do you think men have such a hard time? Like, what was your experience around that?
Well, it's hard to say. I mean, for me, I do talk about my mental health quite a bit. Obviously, I've been advocating for quite a few years and stuff, but even recently, even this winter, I've been having trouble with some of my mental health, and I always find it hard to open up to my wife about it or to like let her know how I'm doing. We kind of have a language now, an unspoken language a little bit. Like I'll drop hints that I know she'll be able to pick up. 'Cause we've been together for about 23 years, so we're getting good at that. But
There's a knowing and an understanding together. Yeah.
yeah, she just knows by the way I'm behaving or even the way I'm breathing. Like she'll say, "You're sighing a lot tonight." Like, I like take deep breaths and she'll be like, "What's shaking? You okay? Or you want to talk about it, or you want me to leave you alone?" But I'm not exactly sure. I don't know why it's so damn hard to talk about stuff with my partner, especially my partner. I almost find it easier to talk to strangers and to therapists than I do my wife. And then, of course, once I do open up, it's like she's super supportive and understanding, and it was like no big deal. And I don't know why I was like pulling teeth, but
It's like you're standing, the analogy I use in session with my heterosexual couples is that it's like you're standing on a cliff. And well, actually this applies to all couples, but when I'm thinking of working with the male and female partners is what you're standing on a cliff and you're looking down the cliff and like you're looking over the edge, you have to jump and you're like, this is too high. This is too high. I can't jump. It's too risky. I can't open up to you. Right.
mm-hmm.
And then what you're saying is then I jump and I realize actually that ledge was just a foot and I landed and they caught me. Right. But the reality is that when we're standing there, because of all of what we have learned and all of the messaging that we've received growing up, that cliff, that ledge seems so high up. And it is so risky to step into that really vulnerable space with our partners, right? That, it's in some way, it's easier for you to share something with me because if I reject you, if I fluff it off or I problem solve or I say, oh, come on, Todd, let's move on, right? You're kind of like, oh, well, Dr. Tracy, like just met her, right?
Mm-hmm.
But if your partner does it, when our partners reject us, abandon us, when they don't respond to our needs, right? If I'm sighing and your partner just says, oh, come on, like, let's move on. Like, what are you doing?
Mm-hmm.
Or you share something really hard and they say, well, it's not a big deal. That's a deep rejection for us because we need our partners. They're our attachment figures. They're safe places for us. We need them to respond to us in moments when we're struggling.
Mm-hmm.
So, Todd, your first question was, why is it so hard for men to open up? What I tend to see is because of the modeling and the conditioning that shows up. There's one thing I want to say before even I think about the societal impact that we experience in terms of what it means to be a man versus a woman. But the first piece is that our brains actually develop differently between a man and a woman, between male and female. And the female brain actually develops differently and faster on the emotional and social side compared to a male brain. And the research shows that. For anyone listening, I highly recommend the book Raising Cain. There's some flaws in the book in terms of who they interviewed and who the practitioners are and the school of boys that they were working with. But it's really solid in the sense of opening our eyes to what that societal impact is. And they do talk about the brain differences in there. So I see this with my own children. My son, he doesn't so easily label, I'm feeling upset that this happens. I call it, he has a shame spiral. He quickly goes into shame, runs down his room and is very angry. Whereas my daughter, so much earlier on, was able to say, I'm sad because I couldn't, or I'm upset. And it was so interesting just to see them as on that level of male versus female. But then you add in society and our conditioning.
Mm-hmm.
What did our fathers model to us? So what was the messaging that we learned of what it means to be dad or a male, right? What did our mothers model as well? Because that's different. And I even see this with my children. So them being two different sexes is that, when my son was 2, when he would fall, the messaging from other people was often, get up, brush it off, you're good.
Mm-hmm.
And then when my daughter would fall, same age, oh no, here you have a bubble, give you a kiss and hugs, and right. So this internalized messaging. So what did we see people model for us? Did we see our dads cry? Did we see them open up about sad, pain, disappointment, or did we just see them blow up into anger?
Mm-hmm.
And then what society tells us to do.
Right. Well, that was something I was going to bring up too, is anger in men. Is it common to see anxiety or depression come out as anger or frustration in a man? And is it because of their influences, like their fathers and stuff, like you were saying?
Yeah, I want to say it's common. I definitely want to say it depends, because I don't want to put everybody in a box and say that every man is like this, right?
Yeah.
But I do think it's important to recognize that this is something that many experience. That what we know about anger is that it's often a secondary emotion. And when I say secondary emotion, what that means is that it's an emotion about an emotion.
Mm-hmm.
It tends to be more complex. There's other things underneath it. And it also serves to keep us safe. So if we think of the iceberg analogy, where you see the tip of the iceberg and that's the anger, and it's just the tip, but we know the whole mass underneath. So oftentimes what's underneath that is fear, pain, loss, sadness, depression, anxiety, worry, concern, all of those feelings. And for anyone listening, you can go to Google and type out emotion wheel. And you can see this whole wheel of descriptive words for feelings. In the middle of the wheel, you'll see 6 core. And one of the core feelings is absolutely anger. When you expand that out to see what this wheel looks like, you will see things in there like, what are some of them? Like unjust, right? Anger makes sense when we have been harmed or wronged in some way. But oftentimes we're angry when we're not connected, or when we're struggling within ourselves. So I do see a lot of men going into anger because they don't know what to do. First, they don't know what to do with the anger and how to express it in a healthy way, but then they also don't know how to tap into this other more vulnerable stuff inside. So it's interesting when I sit with couples in front of me, I often hear, so what tends to happen in a dynamic is that the woman will say, I just want you to tell me how you're feeling. And then he will say, well, I'm frustrated. And if I can get into that a little bit more, what I often see underneath that are feelings like, I feel like I can never get it right for you. I feel like I'm failing you. I'm not good enough. I'm worthless. That's often this underneath stuff of anger and frustration.
Have you been watching my life? Because this is pretty good. I mean, I've come a long way. 5 years ago, I went through addiction treatment, and actually we had one of the handouts we got was that wheel you're talking about, the emotion wheel.
You did. You got it. Oh, amazing.
Yeah. And we were forced every day to tell our counselor how we're feeling. And if you said good, she said, French fries are good. Tell me how you're feeling. Anyway.
I love that. French fries are good, of course. Right.
Yeah. So anyway, and since I've quit drinking, actually, like my anger is like, man, it's like so in the past now. It's crazy. Like I'm a different person. And I think part of that was learning about emotions and bypassing the middleman of anger and just going right to the core of why I'm feeling what I'm feeling. And why are women so much better at that? Like, well, why aren't women walking around angry and all the time, like throwing stuff?
Because girls are taught not to be angry, right? Don't be angry. Girls aren't angry. Girls are supposed to sit there and look nice and be caregivers and smile and nod, right? Like that the messaging, and again, this is very stereotypical, but the messaging continues to be there for what it means to be a girl and for what it means to be a boy. So is there anger? My daughter, she gets angry. Oh, she kicked me in the throat one night during one of her big moments of feelings. Yes. And of course I said to her, I can't let you kick me. And you're angry in this moment. I get it. And it was really hard when I said no. Right. And we know that anger also fades over time. But the messaging though, is that, boys often receive the message of don't be sad, man up. And then girls are, don't be angry.
So is there different strategies when it comes to therapies for men than there is for women? Because like it seems like there's a cookie cutter, a lot of therapists I go to, it's CBT or whatever, which is good, but are the strategies different, I guess? Or is there some new strategy coming out for men? Or
So that's interesting. So based on my experience so far, no. From the research, I don't remember any of the research specifically stating one therapy is better for another. But as a clinician, you do need to know who's in front of you and you need to match them where they're at. So, for example, if one of my male clients comes in and he is highly avoidant, and we know from the rates of, let's just talk about attachment. So, from attachment theory, attachment being when I'm distressed, I can reach out to you. I believe that I'm good, that I can reach for help, and that other people will respond to me. We know that men, there tends to be higher rates in a sample population, higher rates of men being more avoidant than females. That's not a big difference, but there is a bit of a difference. So if I take that information and I layer that with the messaging men receive, that oftentimes I do see men show up in my office not wanting to deep dive into emotions. So if I'm working from an emotion focused perspective, which is I see anger, let's go underneath it and let's dive right into this core piece of shame. And if I do all of that stuff ahead of when my client is ready, I'm going to lose him. So I would say that what's more important than looking at the necessarily therapeutic interventions is how do you feel sitting across from this therapist? Do you feel like this therapist is meeting you where you're at? Do you feel like you're talking about what's important to you right now? And can you trust this person? That's more important than necessarily what type of therapy are we doing?
I see.
Yeah. So the therapeutic relationship is really important. Do I feel comfortable with this person? And then on top of that, then let's see what strategies are going to work for this person. So just kind of as a bigger picture, I work from an integrative model, which means that I take tools from cognitive behavioral therapy, which says, let's look at those unhelpful thoughts and find more rational ways of thinking and healthy behaviors. I also work from an acceptance and commitment therapy model, which says we must accept what we can't control, which essentially is our thoughts and feelings. We can't control our thoughts and feelings. So how do we build acceptance and space away from our thoughts and feelings and engage in meaningful activities? Or I also work in some of the other models of like interpersonal therapies, attachment-based, where I'm looking at more of our relationship and what's happening between you and I. So sometimes what happens with clients is I sit with them and I say, hey, like I notice I ask you these questions about what you're feeling. And each time I do, you shut me down. Can we talk about that? Like what's happening here? You're doing that with me here. Do you do it with other people in your life? What do you think that's about for you?
So it's not so much the strategy or the therapy really. You're saying it's more the trust between the therapist and the client.
Yeah, I think that is so important. And then, of course, what are the interventions that they're using? Do they feel okay for you? And you being able to say to your therapist, gosh, I don't think I'm ready to go into the emotional stuff of that right there. That's not going to help me right now.
Right. But now the hard part is just getting them in the door in the first place.
Yes, so hard.
Is the mental health system set up, more female friendly that way? And if so, how, instead of maybe therapists should just make house calls and feel like, hey, how you doing today? Instead of waiting for them to come to you, you go to them.
Do the wellness checks. Yeah. I think this depends. I think there is some definitely some messaging in there. When I think of some of the tertiary care, so the Royal Ottawa Hospital here in Ottawa, I don't believe that there is a difference between men and women showing up for therapy, for support, for mental health. When I think of my own private practice and other of my colleagues' practices, no, absolutely not. So speaking from my own personal experience, I tend to get more women in my space simply because of what I do in my community on Instagram.
Right.
So I talk more about motherhood. I talk about relationships. So I do tend to get more women, but several of my other colleagues, some of their caseloads have more men on it. So it really is who's the therapist? It depends. But I think what are some of the barriers in here that could be important for us to talk about are things like, again, if we go back to women do tend to talk more about their feelings. And so they're going to have conversations with their friends about feelings.
Mm-hmm.
And they are kind of the nurturer and the gatherer. So, they all get together and talk about the things they're struggling with. They're more likely to be open around those things. Whereas for men, I don't know if you can relate to this, Todd, in the sense of, they tend not to all, sit around outside saying like, hey, like, how's your mental health? Or how are you really doing today, Todd? Right? Sometimes the conversations are more like, oh, are you following this sport? How are the Leafs doing this year? Right?
Mm-hmm. I mean, I I don't know. I'm a weird guy, and so I try to. When I say weird, I like to think that I kind of hang out with a group that I don't want to sound. I hate the words emotionally intelligent, because it sounds like other people are emotionally dumb when they're not. They're just
right.
They just don't know how
it's
to
a scale.
Yeah, right.
Mm-hmm.
So a lot of my friends, we will talk like that. Maybe
Which is
not.
amazing.
Maybe not when I was 20, 25. It took me into my late 30s before I kind of found my crowd of people that do that. But
wouldn't that be amazing if we could do that at 20?
absolutely.
Right. And in some ways, it's almost not fair to state that, right? Because I would also argue that women are not necessarily doing that at 20. They might be a bit more, but maybe not, because their brains aren't fully developed at that point. So it is hard. And so then perhaps what that speaks to as well is, how does our education system help prepare us to talk about emotions, to learn communication strategies, to talk about boundaries, right? And healthy coping strategies. Like, it's when you're feeling angry, here are the things that are helpful, instead of saying alcohol, drugs, avoidance, exercise, food, right? Whatever it is.
Right. Yeah, I was going to get to that. I was going to say, like, my last question was, is the system set up more female friendly, and how do you get the men through the door? And I just, as we were talking, realized maybe it has nothing to do with the system at all, and it has more to do with early childhood stuff like parenting and education system and stuff like that. But even that, like, my two sons, we raise them exactly the same. One shuts down, doesn't want to talk about anything. The other one's completely expressive with his emotions and come to us when he's upset. So it's so even then,
which really speaks to the differences, though, right?
Yeah.
Like that, and I want to emphasize that for anyone who's listening, this is not to say everybody is like this, right? We always have to be careful not to put people in all of these boxes, but that there are individual differences, so that one man might walk through my door and can do this emotional work while the other one may not be able to. And, it's really neat. I can think of some clients that I've worked with, and how powerful it's been that we start at some of the more distant topics of, I'm burnt out, I'm trying to navigate stress, this is a really hard time. And then over time, we start to get into and then my father was never there for me. And then over time, it comes into so I was standing around with a bunch of my friends, and I just said, wow, like, this season of life is really hard. And then we as men all had this conversation around how hard it is right now. Right. And what Emmanuel had really talked about in that live, and I'm so glad that you both have connected, is this idea of opening the door, having these like door opening moments of taking that risk to say it in front of your friends of, I'm not doing so well right now. Does anyone else struggle with depression?
Mm-hmm. And even in my 20s, I guess, I would have those moments, but I was so hammered drunk that I would start crying, I want to die, and all that stuff. And then the next day, no one would look each other in the eye, and then that was it. We never talked about it again.
Right. Because the alcohol served to reduce that barrier, right? It's such a strong barrier that we don't tap into. And then it comes out when that barrier is reduced from the alcohol, right? Your inhibitions are reduced.
Maybe therapists should have offices in bars. So there's like the VLTs, the therapist, the pool table, you know?
Makes me think of the Charlie Brown. There's a Charlie Brown comic or a little figurine that's like 5 cents for therapy. So you have that in the bar, right? Yeah. Yeah. But right, this starts back to our earlier education, right? And so the things you're doing with your children or what I'm doing with my son of being able to say, yeah, this is a really big feeling. Big feelings move through your body. Why don't you hit your pillow? Because physical movement is a great way to get anger out.
Mm-hmm. Do you think, so I never was a jock. I didn't play hockey. I was more of an artsy guy. I wouldn't say I was bullied, but I'd say I just maybe picked on a little bit when I was younger. And so a lot of people call that toxic masculinity. Do you think toxic masculinity has anything to do with men's mental health and them looking for help or even causing the mental health issues themselves?
Yeah, absolutely. There's this I don't know if you've seen it. There's this Instagram trend, and this one video has something like 30 million views on it. Maybe not that many, I'm not sure, but it's a picture of a little boy with glasses and he's wearing a pineapple shirt for picture day.
Oh yeah.
And it's like as a joke, we should ask him out for a dance. And then the next screen is a man with his shirt off who has likely just freshly worked out, the stereotypical no, not stereotypical. Let me take that word out. Not stereotypical, but the toxic masculinity of, this messaging of you should regret bullying me as a kid.
Right.
Which it is such a message. And I actually commented on it and I said, something along the lines of, this is contributing to the message of how men should look. And I imagine that there are other reasons inside why someone would want to ask someone out, right? Something along that lines of just removing this message that in order to be masculine, you don't share your feelings. You're supposed to have your shirt off. You're supposed to, pose in a certain way, whatever that is. But yeah, it's just so harmful for what it means to be a man.
Mm-hmm. Do you find men that maybe fit that role of toxic masculinity, they don't seek out therapists? Or that they're just as miserable as everyone else? But I don't know. They express it as anger, maybe? I don't know.
Maybe. Yeah, they do. They do come for therapy. And it doesn't tend. So in my clinical experience, this is more of a space where there has been an external rejection in some way. So a relationship broke up or they lost a job, that tends to bring them in. Not necessarily this kind of sitting in a lot of depression and anxiety. So sometimes it's like the external reason. And I know people do this in general. All people come to therapy saying there's this external, not all people, I'll retract that, but in a sense of like many people come to therapy saying there's this external thing happening and this is why I'm here, because it feels safe to be able to say that rather than showing up in therapy and saying there's something in me that I keep doing that I'm struggling with that's creating my environment and I need to change that.
Right. So it's easier to blame a situation than to actually feel maybe, I don't know.
Yes, to be vulnerable, right?
Yeah.
What do you think? I'd love to hear your thoughts. And you joined us for that Instagram live with Dr. Cindy and Emmanuel. What did you think about toxic masculinity and the conversations we were having?
Well, I have a feeling that a lot of people that quote or quote follow that personality of toxic masculinity. Well, let's put it this way. So I wrote a kid's book about a dad having depression, and almost all of my customers that have bought that book are female. I think maybe a handful of males have actually purchased it from me. I look at my podcast stats and stuff. It's over 80% women listeners, and quite often my guests are male and I'm male, and I'm a male host. I thought maybe there'd be a lot of male listeners, but no. So I don't know if it's I don't know. I'm scared to say anything and get in trouble.
My question is, could we dabble? And this could be for anybody. Again, I don't want to stay in a box all the time, but for anyone who's dabbling in all of X, Y, or Z, can you also invite A, B, C?
Right.
Because to be open and curious about yourself. So if you enjoy the sports podcast, are you also inviting yourself to enjoy a mental health podcast?
Right.
If you go into the news world, do you also open up to learning other things about yourself? Right. So yeah, we do tend to see higher women engaging in the self-help space.
Right. Yeah.
Than men.
Yeah. What was the point I was just about to make? God damn it. Oh, and it was going to sound good too.
I hate when I lose those moments.
It'll come back.
Happens to me on my podcast all the time.
I think okay. I also have ADHD, by the way, so this happens to me a lot. I've never been diagnosed. It's a thing here in Saskatchewan. It's probably there in Ontario too. That it's hard to get diagnosed, but
yes, it is very hard to get a diagnosis as an adult, for sure.
As an adult, yeah. If I had $1,700, I could get it done, but I do not have $1,700.
No. Hey, Todd, I was curious though, because you mentioned this piece around bullying and toxic masculinity. And, I was bullied as a kid as well. And bullying is incredibly hard. And it really impacts the beliefs that we hold. And when I think about beliefs, there are 3 levels: the beliefs about myself, beliefs about other people, and beliefs about the world, right?
Yep.
Am I okay? Are you okay? Is the world okay and safe?
Right.
And so bullying really threatens those beliefs. And other people then start to feel unsafe. And I think the thing about bullying that so many of us don't realize is that oftentimes it's completely at random.
Yeah, I know. Well, that's the thing, right? So I have this thing again. I live in the middle of Saskatchewan. It's like Boyville. Like the men around here are very manly men, right? And not that I'm feminine. I have a big beard and tattoos. I'm not a small guy or whatever, but I'm vulnerable and I talk about my emotions and whatever. So when I grew up, yeah, I mean, when I think of I don't like using the word bullies because I don't even know if they were bullying or if I was just such a sensitive kid that I took it as bullying. I don't want to sound like a victim. Maybe they were just busting my chops, right? I don't know.
Something didn't feel good for you. Let's honor that.
Yeah.
Something didn't feel good for you.
That's
whether
right.
It was
But I don't want to label them a bully necessarily.
Sure. But whether it was intentional or with malice, I think the point is that it didn't feel good for you.
Right. So then you talk about the 3 beliefs. And so I do have a bad taste in my mouth for some of these bros around here, I'll say. At the same time, I'm very social with them, right? Like I live in my town. I'm well liked and respected. But I think it's more the worldview, like you said, that whole bro worldview and toxic masculinity I have a problem with. So that's why I'm scared to say too much because I'll get in trouble because of my own beliefs that were, created when I was a kid. So I
think what's important there, Todd, is acknowledging what's underneath that. And that is not to excuse the behavior in any way, but to identify that we all have to put something somewhere. And so for many of these kids who do end up bullying, they don't have anyone that sees their emotions. They're being rejected at home. They're struggling with stuff inside. And so they put it outwards because they're not doing anything with it on the inside. Right. And that doesn't make it okay in any way. I think sometimes that understanding can offer us a space of compassion to the reason other people do things. It was so interesting. I don't know if this is relevant or not. I'll share this, but one of the bullies that I went to school with, he actually sent me a Facebook message several years after we finished high school and said, "I'm sorry. I know I bullied you, and I'm really sorry that happened." And I don't think he's looking anything from me, but it was just such an incredible relief. And I didn't go into it. I didn't ask what's going on in your life now that you wanted to share this with me. And instead, I just kind of took it as an offering of, wow, like that's incredibly powerful. And that if at any time we have found ourselves falling into these patterns that are not helpful, it's a lot to be able to step into something and say, what I did then wasn't so great. It's
Mm-hmm.
healing for ourselves and then healing for other people, which makes me think of that kind of expression that people say, hurt people hurt others,
Right.
healed
Yeah.
people heal others.
Hmm. I haven't heard the second half of that. I've always only
Mm.
ever heard the first part of that.
Mm-hmm.
Yeah. Yeah, it's weird because one of the reasons I don't want to say that these people were bullies were because they're in my friend group too, right? It's just dudes busting each other's chops and
Yeah.
like, but it, it's like, okay, I get it. I'm skinny. I'm a pussy. Yeah, yeah, great. Like, I know you're my friend and I don't, but at the same time, it's like, I
But
get enough of
again,
this
it's
shit.
that space of not learning to be able to say, hey, man, cut it out. That doesn't feel good.
Right.
Right.
Wow. Oh man, if I said that to my friends, it would have just made it worse. They would have, oh, it bothers you, and then they would have jumped on you more. And I'm probably guilty of that too. For you know, I try to get my comeuppance with someone else and bust their chops, and then it really.
I think we're coming back to the toxic masculinity piece here, where it says
Yeah.
like we connect over humor and busting each other's chops rather than being able to say we connect
Yeah.
authentically. Yeah.
Absolutely, yeah. Well, that's that's something I kind of talk about anytime I'm doing any speaking about my own life. It's like that. Oops, that almost I'd say toxic humor even, and drinking were basically the only things I had in common with some of my friends in my friend
Yeah.
group because I grew up in a small town. So it's like, okay, here's your 5 boys in your class. Best of luck, right?
Right. Of
You
course.
don't have a lot of options, but
Yeah. And that's what it is, Todd, right? When we're growing up, it is survival. We don't get to choose our parents. We don't get to choose what they do with their emotions and the things that they're going to teach us. We don't get to choose the city, the school, the small schools. I grew up in a small town as well. I can completely appreciate that. You travel with the same people all throughout. And it's hard, right? And I think it's important to recognize those as defenses, as ways that we protect ourselves. I'm uncomfortable, so I'm not going to show you my true self.
huh. Yeah, well, I've been told lots of times that my humor is a defense mechanism, and I'm quite sure my drinking was too.
Uh-huh.
I'm
Yeah.
positive, in fact. Um, so now I'm going to change directions a little bit. This is a question I really wanted to ask you. Um, so I've seen, or I've heard, or read, things about males and their partners, and a lot of times their partners, or any female in their life, really are like, step up, be a man. I don't want a pussy for a husband and all this stuff, but then give them shit when they don't open up. And it's like, well, what the hell do you want from me? You know what I mean?
Uh-huh.
Do you want this big masculine man? And then you're surprised when he's yelling and throwing stuff, and instead of opening up to you, you know what I mean? Do you ever hear anything like that or see that?
Yeah, I definitely have. I definitely
Yeah.
have. And it's tough, right? Because again, then when I see that my role is to help address that unhelpful belief. So when I'm working with a woman partner and she's saying, I just want my partner to be a man, I just want him to step up.
Mm-hmm.
I'm breaking apart that belief and challenging it. How does that belief help you? What are other ways of seeing your partner's behavior? What is this really about for you? What is the longing inside of yourself, right? So if I'm sitting with a woman, I'm going to ask her, what's the longing inside of yourself when you're saying to your husband, step up and be a man? Well, and I'll just kind of play this out, but it could be something like, well, I need protection. Okay, so what does protection look like? It doesn't necessarily mean be a man, but protection, is it the emotional protection? Do you need him to come close to you to give you a hug? Because what happens here is when you go into this critical space of step up, be a man, that's criticism, right? When you go into criticism and contempt, this is working against what you are looking for, which is for your partner to come closer to you. Because instead, what happens is they get defensive and they push you away, or they shut down, or they walk away. So let's first work on your own individual belief about what your partner's role is in your relationship, how you view men, and then also let's find a way for you to connect and be close.
But have you ever had a male client talk about this situation, or is it usually a female client that says this stuff?
Oh no, it comes out from the men I work with as well. Like, what I'm trying to think of, like, the dialogue would be like, well, I shouldn't really talk, like, I don't really talk about my feelings. That's not just what I do, right? Like, I definitely hear that. Would they ever say that to their partner? Yeah, I think I've probably heard it before. Nothing's coming to mind right away, but in the sense of,
Right,
like,
okay.
and I think this is the thing, is that so many of us have grown up with these narratives given to us. So then when we get into this dynamic in our partnership, it does show up, because again, it's the belief that as a woman, you should be helpless and the caretaker, and you can't change the tires on your car. So then you seek out the tough masculine male part, right? And, it's ironic, if we actually even just step away from this kind of concept of toxic masculinity, if we even just go into looking at masculine and feminine qualities of people.
Mm-hmm.
In my own relationship, I definitely step into a masculine quality often. I'm looking at parenting stuff. I'm tend to be the leader of things just because of my personality, because in my workspace, this is what I have to do.
Mm-hmm.
But when I go home, it's also important that I balance out that masculine part of me and also tap into my feminine part, which is, I'm also going to be a caretaker. I'm also going to let my partner lead. But that is quite a different concept than having to look at what we're saying of, like, do you know what I mean by that? By toxic masculinity? Yeah.
It's quite the spectrum, and it's quite complex, isn't it?
It is.
And then,
but I love this conversation that I'm seeing more men having. I haven't read his book, Justin Baldoni. What's the book? Man Enough?
okay.
Is that what it's called? No?
I don't know.
Yeah, Man Enough.
I tend not to read. It's the ADHD in me. It's like I got to be doing something.
Check out his podcast, because he's also, he has a podcast. He's had someone like Shawn Mendes on it, and they've talked about, and Matthew McConaughey was also another guest. They've talked about, what it means to show emotions. How do you balance family life and also your career, and being vulnerable and open? So I think this kind of path of opening these conversations is really important. And even if your listeners are not the majority of men, what is interesting, though, is that their partners could be listening and tuning in, Todd. And then they're the ones sitting at the dinner table saying, hey, I listened to this concept about this. Like, what do you think? Right. And so it starts to, like, I always call this like planting the seed. So it's not necessarily that, a male listener is coming in and listening to the podcast, but his seeds of change are growing by someone else listening to it.
And I find that too with women that buy my kids' book. It's about a dad, and it's, I don't know how many times women have been like, oh, my husband struggles, but he would never come and buy this book. So same thing. They're just planting that seed, and like, leave it here on the coffee table and see, whatever. But, and yeah, it's nice. Like, I don't know if this kind of conversation is happening more often, or if I just seeing it more often because I'm kind of in this, this topic. But there are a few male groups that I see on Instagram that I joined, and they are a little misogynistic at times, and but at the same time, I want these people that are hurting to heal, and so they are, support for each other, and they are helping each other, and they are healing each other, but it's a lot of bashing the ex-wives or whatever, what I mean? It's like they were screwed over by an ex-wife. So then it's like I read the thread and it's all just, this kind of yucky stuff. They're the victims, basically, is what
externalizing.
They are, right?
Yeah.
Yeah. And it's like, I don't know if I want to join this group, but at the same time, I hope, I wish you all well and you get all the help you need, but this isn't quite the thing for me.
And that is the thing, right? So yes, it is okay to be hurt and upset about the things that have happened. And also we all must recognize what the role we play in is, right? So for example, if I go back to your question before about step up, be a man versus I want you to open up to me. A woman needs to acknowledge the things that she does that prevents her partner from opening up to her. So for example, if you were to go to your partner and say, I'm feeling anxious. And if she says, oh, Todd, just get over it, you're fine, she shuts you down. So the next time, do you think you're going to go and open up to her? Or you go to open up to her and say, I'm really struggling today. And she says, okay, well, why don't you just go for a walk?
Mm-hmm.
That
Or, yeah, me too. My work is so bad. And then, it's like, oh, okay. Now it's about you, I guess.
now we're back to you. Okay. Right. So, there's this dynamic that exists between two people, and that no one person is responsible for that dynamic. I'm putting my hands back and forth as if it's like an infinity loop, because what we know is that as one, when you're dancing with a partner, when one person steps forward, the other responds by stepping back. And then when that person steps forward, right, you go back and forth and they affect each other. And so we then need to recognize that if I'm showing up to this space and being dismissive to you, I'm minimizing, or I'm problem solving for you, then no, you're not going to come and open up to me. I tell this story in my Instagram space because it was such an important moment for me. And that was around my partner saying one day, and I just don't want you to leave the banana peels in the sink.
You leave banana peels in the sink?
Oh, every day. I did it every day.
God
I'm sorry, Todd.
You have a very patient man.
and so this day he came to me and said, I want to tell you something. I said, okay. He says, please don't leave your banana peels in the sink. And if I had have been like, oh yeah, okay, well, let me give you the running list of all the things that you don't do that I've asked you to, right? That's the criticism. I can step into that critical space. But instead I said, okay, thank you for telling me. And it is when you step back and you think, okay, it's just banana peels, but it symbolizes so much more, that now my partner sees that I can respond to banana peels, so then maybe he can come to me and tell me something bigger next time.
So because you agreed without fighting or defending yourself about the banana peel, he may open up about some childhood trauma that happened to him? It's that simple?
Well, it's not that simple, but communication for couples is years of work, right? So it's not that simple. I don't want to oversimplify that, but it creates. I know, I love it. It's the messaging, right? What message am I giving? So yeah, I think we need to be aware of that. Yeah.
Well, I'm 44 and I've been with my wife for 23 years, and there's been, yeah, like I told you, I've been through addictions and stuff, and there's a moment in my life that I didn't think we were going to be married anymore, but I'm so proud of her for us getting through that part. I don't know, I'm kind of rambling now, but at that time I found help for myself. She found help for herself because there were some past things she needed to deal with. Mm-hmm. And I remember she said right away, it's like, okay, this isn't all on you. Like some of the troubles we're having, sure, you're the one that's, displaying the most negative attention or whatever, but obviously I have to work on something. So we both worked on each other, and then we worked together with a therapist, and it was, life-changing for our relationship. So mm-hmm. I don't know why I brought that up.
I think you're sharing that you have to be ready to do the work, right? That we all have work to do. It doesn't mean anything about our worthiness, right? Going for therapy has nothing to do about your self-worth. But if you're not feeling worthy, then definitely go for therapy. The piece, though, is that, even if you're not ready, like we often think I have to be ready to change to go to therapy, you can still seek help from people when you're just not quite sure. You maybe know something needs to change, but you don't know what. That's also a space to seek help. And the one thing I wish is that people would not wait so long to get help.
Right.
That we would go sooner.
Yeah. I definitely know that feeling of seeking help and not being ready to, like, first 2 years of off and on therapy, it was like I was just doing it to make everyone else around me happy. It's like, well, I'm going to therapy, and I wasn't doing any of the work. I was just like, they're not fixing me. I don't know, they haven't cured me yet. And it took me a long time to I'd probably say another 3 years, And then once I went into addiction treatment, that's really when I started doing the work and started, yeah. I think it was like I was sick of myself. I wanted to be able to do the work, but it was so scary.
Yeah.
For me, it's so scary. And I wonder if that's another reason why men, I mean, I don't know why it's less scary for women. I guess we kind of talked about it.
It's incredibly scary. I think that's the piece. It is really scary to go and sit in front of a stranger and to talk about something that doesn't feel good.
It's the part that, I'm so scared I'm going to feel those feelings again that sucked so hard. It's like I don't mind talking about it, but I'm more scared about if I talk about it, then I'm going to feel something that I don't want to feel. And that's the scary part. And I don't know if you read my one email I sent you, some of the stuff I've been going through lately.
I don't remember specifically about it.
Okay. Yeah. Damn it, I wish you saw it. I've kind of been working through some childhood trauma, right? Like just right now, like I'm presently working on it. And I've only said a couple things out loud twice. And both times I've said them out loud, it's like a 2-day hangover. Yeah. And I knew it would happen, and it was so scary, but I was like, okay, but I got to let these feelings out. So yeah. And I didn't expect yesterday I talked to my parents for the first time about some of this stuff. And
yes. It's a lot to unpack.
It was like the next 12 hours was like, I just put me in the psych ward again. Like I feel like such crap.
And those are those moments, right, Todd? Like you're doing the hard work and it's not going to be easy. And those are the times where we really need to, and there's a reason you're doing the work now versus 4 years ago. You weren't ready 4 years ago, right? I think that's important that when we are doing this work, we have to remember that there is a timeline. There isn't a timeline, but there's a process through this, that you're not going to do this heavy lifting like this deep emotional work at the start of your therapy process or the start of your healing, because you need to build up your resilience. You need to build your resources so that hopefully now what is now a 12-hour hangover is not the 2-week, month-long, whatever it was back then, right?
Well, I'm sure I would have relapsed if I would have brought some of this stuff up earlier, or I never would have seeked help. I would have talked about it, and I would have just kept going down further and further. My bottom would have kept dropping lower and lower.
Thank you so much, Todd, for inviting me into your space. I truly appreciate it. And I'm really privileged to have received your book and to know that this is a resource out there, because I can't emphasize enough that these are experiences that people are having and they don't have things to talk about. So thank you. Thank you for this work that you're doing.
Thank you, Tracy. That was really, really amazing. I can't wait to talk to you again we'll pick a different subject matter and let you go because you are a very smart lady. And I appreciate that. And I appreciate you being on the show. Now, if you want to follow Tracy on Instagram, it's Dr. Tracy D on Instagram, which is DR as in doctor, Tracy, TRACY, and the letter D. I'll also put a link in the show notes, plus a link to her website, which will take you to her podcast and everything else she's doing. So once again, thank you, Tracy. And in 2 weeks' time, I will be talking to Chris from Accidental Impacts, and that's all about accidental killers and some of the trauma that they go through. So stay tuned for that episode. Okay, everybody, have a good couple weeks, and I'll see you next time. Thank you for listening, and please subscribe, rate, and review however you are listening to this podcast. It only takes a moment, and it really helps the show out with getting noticed. This episode has been sponsored by Penny University Bookstore, 3104 13th Avenue. Call 639-571-2186 and check out their online bookstore at pennyu.ca. The Saskatchewan Podcast Network is supported by Connexus. Wellness, however you define it, is achievable. You don't even need to figure it all out by yourself. Talk to Connexus. They'll give you guidance, motivation, and the push you need to reach your goals. They've got you. They're your financial partner, and they know you can achieve your very best, your financial best. Prove them right. Start right at Connexus Credit Union. The Saskatchewan Podcast Network is also sponsored by Direct West. Are you a business owner looking for new avenues to promote your business? Direct West digital billboards are a great opportunity to highlight a new product, new promotion, or anything else you'd like your customers to know about. You can get local, expert marketing help for your business at directwest.com. If you are having a mental health crisis, please call the Canadian Crisis number at 1-833-456-4566. In Saskatchewan, the mobile crisis team in Prince Albert is 306-764-1011. In Regina, it's 306-525-5333, and in Saskatoon, it's 306-933-6200. Don't forget to check out my children's book, Sometimes Daddy Cries. Sometimes Daddy Cries is told through the eyes of a boy whose father suffers from depression. He sees his dad get sad, rest, and even go to the hospital, all while comparing his father's depression to a physical ailment. Available on Amazon.ca. I'll see you next time. This is Todd Redebaum saying, make your beds and take your meds. Bye.